James Kaufman, World News Report today, July 6, 2025. God bless you and yours, no matter where you are in the world. Please subscribe, give us a thumbs up, ring that bell for critical future updates. 21 states across the U.S. now reporting COVID razor throat variant. At least 21 states are reporting a COVID-19 variant that spread across China earlier this year, according to newly updated data provided by GISAID, a map released by the Global Initiative on Sharing All Influenza Data, or the GISAID, shows that 21 states in the United States reporting COVID-19 variant NB181 as of Thursday afternoon. We can all imagine what this map will look like in about a week after everyone returns from their 4th of July holiday travels. This COVID variant is about to blow up, I can assure you. The most recent estimate from the Centers for Disease Control and Prevention suggests that between June 8th and June 21st, the NB181 variant now makes up 43% of all COVID-19 cases in the United States, making it now the dominant strain. Separately, the CDC says that across the United States, COVID-19 levels are, quote, currently very low but anticipated to rise after the 4th of July travels. Outside the United States, Chinese health officials said in June that NB181 was driving a wave of infections across the country. And Chinese doctors at Peking University last month predicted a peak of nationwide COVID-19 cases in July, also stating it may become the next dominant global strain, with symptoms including a sharp sore throat, fever, runny nose, vomiting, and diarrhea. Due to the Chinese Communist Party's history of covering up information and publishing unreliable data, including data on COVID-19 infections and deaths, information provided by local doctors and health workers could provide more context about the situation on the ground in China. The World Health Organization, or WHO, has designated the NB181 as a variant under monitoring and considers the public health risk low at the global level. Current vaccines are expected to remain effective. Previously, WHO said some Western Pacific countries have reported increases in COVID-19 cases and hospitalizations, but there's nothing so far to suggest that the disease associated with the new variant is more severe than previous variants. With that said, I think everyone knows after the holiday travels, this thing is liable to blow up around the entire U.S. God bless you and yours. Please share, subscribe, and always remember, anything's possible. Bizarro world.